Hi, folks. Thank you all for joining and for your patience with us. We have been waiting for our last presenter, but hopefully she can join at another point during the presentation. So we just appreciate your patience with us, but we're going to go ahead and get started. So this session is about when bishops make your healthcare decisions, what are religious restrictions that healthcare facilities and hospitals can place on folks, and what is their impact specifically on Black women and people of color? And then next slide. So we'll go ahead and introduce ourselves, and then would love to hear a little bit more about who you are, and you could put something in the chat. So I'll start. My name is Amanda Young, and I use she, her, hers pronouns, and I'm an organizer here in San Francisco for ACLU Northern California. And I'll pass it to Arnita.
Hey, good afternoon, everyone. My name is Arnita Rogers. I use she and they pronouns, and I'm an attorney at the ACLU of Northern California, and I call Oakland home, and I'm happy to be here with everyone today. And our last presenter is Lori Roberts, and we're hoping that she'll be able to join. And Lori is the executive director at the Yellow Hammer Fund and also the Mississippi Freedom Fund. And so she conceived of this presentation with us, so we're hoping that she's going to be able to join soon. So next we're going to turn it over. I think we've got a relatively small group, so we'd love to hear from you all, who you are and where you call home. So what do you think, Amanda? Have folks be saying in the chat or come off mute?
Yeah, if either way, if you want to put in the chat, it'd be great, or if you want to come off mute. I realized I also forgot to share the check-in question, which is something bringing you joy right now, because this is a heavy topic, and we wanted everyone to ground yourselves in something that brings you joy, because it's really important as well as we're digging into these topics. So for me, I've been telling anybody who will listen that we just got a new puppy, and just having him cuddle on the couch is the best thing in the world. Arnita, do you want to share?
Sure. Actually, just being at this conference right now is bringing me joy. Some of the presentations, the speakers, Raquel Willis this morning for me, I'm on the West Coast. I think it was lunchtime for everybody else. I thought was really enriching and energized me and grounded me. So it's bringing me joy to participate. I'm bummed we can't be together in person, but I'm feeling the connection even in this virtual space. So it's good for me.
Thanks, Arnita. Yeah, if folks want to write in the chat or take yourself off mute, we'd love to learn more about who's in the room right now. Thanks, Sonia, for sharing. Dumplings are great. I will echo that. Definitely bring me joy. Thank you, Abriana. Some more folks. Cool, we have folks from all over. Paulina and Monique. And please continue using the chat throughout to talk to one another or ask us questions, and we'll do our best to answer all of them. But I think we can continue. So hopefully Lori can join at another point and share her story about how this issue has impacted her. But I think first we can talk about an example of how these religious restrictions from hospitals can be really life-threatening and damaging. So this is Tamesha Means, and she was denied care, proper care for a miscarriage, and it led to a life-threatening situation where she almost died. And it could have been completely preventable if the Catholic hospital where she was at had not denied her proper care. So she was 18 weeks pregnant with her third child when her water broke, and she was living in Michigan, and she was rushed to the nearest hospital, which was operated by Mercy Health, which is a part of Dignity Health, which is a Catholic hospital, which has notoriously placed a lot of restrictions on reproductive and gender affirming care. And the hospital gave Tamesha 2 Tylenol and sent her home without telling her that there was virtually no way that she could give birth to a healthy baby, because they wanted to avoid her having a miscarriage at their hospital. She returned the next morning with bleeding and in severe pain and showed signs of infection, but again, she was turned away, and they only treated her when she began to deliver, but the baby died within a few hours. And this was not proper healthcare for her to receive in this situation. She should have received care for a miscarriage, but instead she was put in this life-threatening situation. And this is an example of just how harmful these religious restrictions on care can be to folks, especially women and people of color. So why we think this is a problem is because everyone deserves access to the care that they need, regardless of where they live. If a service is available to anyone, it should be available to everyone. And a lot of the times, people don't realize that the hospitals that service them, that are close to them, are Catholic or are religious and have restrictions on their care. And that's not fair. Just because of where you live, you should be able to have access to the comprehensive healthcare. And everyone is entitled to their own religious beliefs, but this does not give them the right to harm others. So religious hospitals should not be able to inflict their own beliefs on the type of care that patients receive at those hospitals, especially because most patients don't realize that those hospitals actually have religious restrictions. And finally, reproductive and gender affirming care is basic health care and should be given at the full and comprehensive care level. So these religious refusal laws are threats to reproductive and LGBTQ rights and justice in the country. So this is happening as the expansion of religious refusal laws under the Trump administration, which have threatened access to healthcare programs and services. And you may have heard of these conscious rights rules that have been passing in various states, which allow people to cite religious or moral beliefs to deny healthcare for people. And especially now that we have a conservative federal courts and also a 6-3 conservative SCOTUS majority, this is really a problem at a national level. And we predict that religious entities will be able to have more and more autonomy to inflict their own religious beliefs on the type of healthcare that people can receive. So why do these Catholic hospitals, why are they allowed to have these restrictions? And a lot of people don't realize that they're actually, there's a doctrine called the Ethical and Religious Directives, which are based on Catholic values and beliefs, which prohibit many services, including abortion, contraception, and sterilization as intrinsically evil. And that's a direct quote from these ERDs. They deny procedures to transgender patients that are performed routinely for cisgender patients at their hospitals. They limit the information and referrals that can be provided to patients. So even if a patient asks, where else can I get this healthcare service if you don't provide it, those hospitals can't even tell them where they can go get that care. And these healthcare denials disproportionately impact low income and communities of color, which are most impacted by Catholic hospitals and also are least likely to know that those hospitals do have these religious restrictions. And now I'm going to turn it over to Arnita.
Cool, thanks, Amanda. And so what we really want to focus the majority of this discussion on today is following up on what Amanda was saying, that patients of color are disproportionately impacted by the harms of restrictions in care under Catholic hospitals. And so back in 2018, just a couple years ago, there was a really awesome report drafted by Kira Shepard called Bearing Faith, the Limits of Catholic Healthcare for Women of Color, that really explored some of the compounding inequities that occur when people of color, and primarily women of color, are forced to receive healthcare under religious restrictions. And so some of the key findings from the report, and actually Lori Roberts also participated in the research for Bearing Faith, but some of the key findings from the report were that, people of color, primarily in people of color, meaning in this context, Black and Latinx patients were more likely to be served at Catholic healthcare facilities. So in Maryland, 31% of Latinx patients and 28% of Black patients were likely to give birth in facilities operating under the ethical and religious directives, compared to just 11% of white patients. And in Tennessee, Black patients made up 29% of deliveries at Catholic hospitals versus just 19% delivering at non-Catholic hospitals. You can go to the next slide. Sorry, I think we went back.
Sorry, can you see the slide now?
Yeah, could you go, I think we went back one. Could you go forward? Oh, sorry. Yeah, we did. I'm sorry.
I think there's just a delay. Sorry.
Okay, I'm sorry. Yes. And so also patients of color generally are more likely to rely on services that are explicitly barred by these ethical and religious directives. So BIPOC patients are more likely to rely on sterilization as a form of birth control. They're more likely to be denied postpartum tubal ligations after C-sections, despite it being the standard of care for having that service and having that procedure done. And Black and Latinx patients seeking sterilization are more likely to have public insurance, and so often face greater barriers to obtaining the care that they need, since Catholic hospitals are also the largest provider of care for patients with public insurance, and serve more low-income patients. And so compounding the barriers and access is that folks don't even know that they are going to hospitals that operate under these ethical and religious directives. It's no fault of their own. It's often very opaque, intentionally and opaque by these healthcare systems about what services they provide. But low income and patients of color are less likely to know that their hospital is Catholic, and it's a result of a lack of transparency about the scope of care and the actual services that are provided. And then, of course, folks might live in places where they don't have, a variety or a number of healthcare options, whether it be because of the type of insurance that they have or where they live geographically. So fewer options to actually go someplace that isn't operating under these restrictions. But we know, the right to bodily autonomy and reproductive justice demands that, we be able to, and all patients, everyone be able to make fully informed decisions about their healthcare and their body. And so, that's why these restrictions are so pernicious, so harmful, because they really strip us and strip anyone having to, seek care in these instances when there aren't other options available to, make decisions, that having that ability stripped from them to make the decisions about their own lives. I'll go next slide. Oh,
yeah, I think that Lori just entered, which is amazing. Hi, Lori. Maybe we should pause, and Lori, you could introduce yourself. And
sure.
Would love if you could share a little bit more about your own story with.
Did we already hit that slide? Gosh. I'm sorry.
No worries. I'm glad you made it.
So I'm Lori Roberts. I'm a currently in between states. I'm in Mississippi and Alabama. See, this is why I was late, because I was trying to, let me turn my video. I was trying to find my Ethernet cord adapter so that my internet would be better. So I'm the outgoing ED of that fund, and I am the current ED of the Yellowhammer Fund. But I'm also a survivor of dealing with ERDs in my former community in Indiana, where a Catholic hospital was our primary provider, even when there were 2 hospitals, and is now currently still the only provider in Michigan City, Indiana. And when I went there for miscarriage care, when I went the first time, they were like, hey, you might be miscarrying, go home. You know, I wasn't really bleeding yet. I just had some discharge that was weird. And when they were like, come back if you're bleeding, I came back and I was bleeding heavily. They did an ultrasound. They were like, oh, there's still a heartbeat. We can't help you. Which in my mind at 18, I was like, I don't really understand what you're saying to me, right? Like, I mean, I don't know what you mean. So, yeah, so I went home, and within, it wasn't even 24 hours. It had to have been like 12 hours. I was hemorrhaging. And I mean, I was bleeding so heavy. I ended up putting on one of my young daughters. I had twins at the time who were babies. I put on one of their diapers because that's how heavily I was bleeding. And I ended up passing out at my mother's house. And they called the ambulance. I was going into shock. I was like, I had to have an emergency blood transfusion. And I still to this day wonder, would they have treated me with a DNC and done what they needed to do had I not already passed the embryo at the house before I got there, which I was not completely aware of at the time. But yeah, and one of my most present memories in my mind is of my doctor was on the emergency staff when I came in the 3rd time, and he was Catholic, he was Nigerian, and he was screaming at the staff saying, who the F sent her home? She could have died. So like, he got it. Like, he's Catholic, but he got the, like, in no uncertain terms should I have been sent home. And I remember overhearing him saying, but you could have, to the gynecologist on call on the phone, but you could have kept her and watched her. So, you know, it's not like this was a new thing. This happens. Yeah. And if you read the Bearing Faith report, I'm the first story in the report. you open the report and my picture is like the 3rd page.
Yes. Thank you, Lori, for sharing what is a horrific story, and, you know, and has parallels with Tamesha Means' story, very eerily similar from what we discussed. I don't know if there's anything else from like the Bearing Faith. I know you were featured in that report. If there's anything else you wanted to share, I know we had talked about it when we were discussing this.
I just think that the findings that are consistent with things that I have seen in the community as a doula, and the stories that I've collected. You know, like, as I've shared my stories, like, people will email me, people will message me on Twitter and tell their stories. People will just tell their stories in threads. And so it's nothing is inconsistent with things that I have been told, things that I have heard. I mean, like, even my daughter had a therapist at one time who was telling the story of how she had a Catholic provider who treated her really rudely until she realized she was married. And then, like, during her pregnancy, and then the minute she realized she had a wedding ring on her finger, like, she was super nice to her, and like, you know, like, her care for her just changed. And like, I just really wonder how often that's happening to young Black women, and we're not even aware of how badly we're being treated due to the context of like this religious context. Like we're used to the racism context, right? So I think sometimes we don't even realize that there's this added religious context on top of it, because we just think that it's like the, excuse my language, it's just the shitty way that we're treated as we go through the medical system, because we're poor, because we're Black, you know, because we're queer, whatever. We're used to those layers of oppression, and we're not even aware, looking for this other, you know, this other layer of oppression that is coming along. And so that's what really concerns me, is that as I was going through my young, you know, my late teens and early 20s dealing with this Catholic hospital system, it never occurred to me that the reason I might have been denied for an IUD was because I was going to these Catholic providers who weren't just telling me straight out, you can't have an IUD because I don't provide IUDs. They would just give me these, well, you might want to have more kids discussions. Instead of just being straight up with me, you should go to someone else because I don't do that. And that's what concerns me. Yeah. Because it also impacts your pregnancy care, right? Whether or not they feel like they can force you to have a C-section, whether or not they feel like they can force you not to have a home birth, whether or not they feel like they can turn you into, you know, government agencies for your pregnancy choices. It factors into criminalization because they see fetuses as people. So I'll leave that there.
Thank you. For me, I might drop. And I think dovetails, you know, to what we were talking about, or from what we were talking about, like the, you know, complete stripping of bodily autonomy in so many ways, not just about like that reproductive health care decision at the moment, but in so many other ways of even entering into a criminal legal system, other systems that might be implicated based on the bias and stigma that folks encounter in navigating these systems. So thank you. Okay, so let's see. Before I jumped into the next section, I saw one question in the chat box from Paulina, sorry if I'm mispronouncing your name, that said, do Catholic hospitals locate themselves specifically within those communities? And I would say that at least what we've seen in California is that Catholic hospitals or other religiously affiliated hospitals, we also here in California have the Adventist health system, which is, they also have religious restrictions on healthcare that aren't necessarily, we don't know them to be as restrictive as the ethical religious directives, but they do still impose religious doctrine in healthcare decision making. We see those hospitals merging and taking over more and more of the market share, especially in rural areas throughout the state, in places that hospital systems that are you know, would be serving the underserved. And so, yes, I would say, you know, I don't know if it's completely intentional, but, you know, kind of seems that way, right? Around, you know, where they're choosing to take over the market. So that's a good question.
I would say yes. Mm-hmm. And I would say yes. And not only that, I would say that they have been empowered to do so ever since the Bush administration, when he did his whole faith-based initiatives and was encouraging faith-based organizations and faith-based providers to go into low-income or areas, right? Like there was all that encouragement and money put into different sectors for faith-based organizations to provide healthcare community resources. So if you could tie your healthcare providing system into outreach for certain, you know, for certain communities, you could get more money. So does that factor into it? I don't know, but I would say probably, because money, you know, like follow the money. So I just think I don't think it's coincidental that like the uptick in like a lot of these places showing up in our communities happened right around the time that like faith-based organizations started getting government money. You know, I just, you know, that just seems pretty sus to me. But also, I just think that it also goes along with their kind of their initiative to be like, we reach out to the poor and the needy, and like we can say that we're out here doing the thing. And it's like, yeah, but not really. like kind of in
Totally.
like the worst way.
Totally. And what you'll see, like on like the mission statements of many of these hospitals and healthcare systems, that they're mission driven. This is part of the service of serving the underserved, you know, but they oftentimes try to cast reproductive healthcare and LGBTQ inclusive and gender affirming care for trans folks as some different type of healthcare. It's not basic healthcare. It's something else. It's additional. It's not, you know, what is required for our survival, and that is just basic healthcare. They try to make it seem like it's something different. So totally agree. Cool. Let's see. So Amanda, you want to go to the next slides and then we can. I think you might be on mute.
Sorry. I think there was one question that Monife just put in the chat. Arnita or Lori, do you have thoughts on that? Is there a way women can be provided information about these hospitals before going to them for delivery? / is there a way that doctors in these types of hospitals that have more of a caring philosophy, like the doctor you had identified, I think, Lori, so women can move to those providers opposed to others?
I think this is one of the times when it's important to talk about Black birth workers and, you know, the importance of having Black and brown birth workers, but especially Black birth workers in the space, in the community, because we're the ones who know who these people are. And when you have a connection with doulas, midwives, but especially doulas, right? Doulas are the ones who know who the crappy providers are. Even if you don't get a doula, but like if you're connected to with the birth worker community, you know, low key, we keep a list. I don't know no doulas in no community that don't keep a list. And a lot of times, because of liability reasons, we can't just like tell you outright. We can't just like say, because it's almost slander, right? So like we can't just say this is a crappy doctor. Well, a lot of people won't. I will. I don't care. But some doulas won't. But if you ask, hey, do you know of providers that do X, Y, and Z? People will say it. And I would say that it is, it needs to become an objective for Black birth workers to be putting it out there that like, hey, do you know that this hospital that's not even labeled as a Catholic hospital is a Catholic hospital? And this is what they can and will do to you while you are getting provided, you know, pregnancy care, or while you're getting your OBGYN care. Did you know that this is like the stuff that you can't get there? Like, this is why they never will refer you for a tubal. Like, sometimes we know and sometimes we don't know. Like in my community, everyone knew you could not get a tubal in our county, essentially, because there was nowhere to go until someone built an independent birth center. Not birth center, surgical center. Well, where they did other stuff, but the major surgery they did there were tubals, because before they built it, no one could get a tubal because the hospital wouldn't do them. That's absurd, right? Like, that's the most absurd thing. So like, I think the importance of like community activists, community groups, the doctors aren't going to do it. It's got to be us, right? I always say we all we got, and that's real. It's true.
Yes, definitely second that. I mean, and then yeah, I mean, and in some instances, individual doctors will try to, you know, say they have workarounds to kind of subvert what there's, you know, the restrictions that they are contractually, you know, obligated to follow, even though it might be in opposition to the standard of care that they've been trained under and that they believe, you know, that they should be following. So for instance, you might hear of doctors that are practicing in a religious hospital or a Catholic hospital say that they are still allowed, they still prescribe birth control because there are restrictions even around prescribing birth control, but they can't prescribe birth control for the purpose of contraception. But, you know, if someone says that they are struggling with, you know, having heavy menstruation, heavy periods, then they're allowed to prescribe birth control for that purpose. And so, you know, sometimes doctors will say, well, you know, there are workarounds. And that is also an argument that some of these hospitals, like when we, I'll talk about in a slide or two, we've been in a campaign, the University of California healthcare system, university system has been trying to merge with a big Catholic healthcare system here. And so one of their arguments when we've said, okay, you can't do this, like, you're a public hospital, we can't have these restrictions on care. They said that there are workarounds that the doctors can do to make sure that they can still provide the care, even in the presence of these restrictions. And so we know that's not, necessarily these doctors, they're not, their jobs could be on the line. Say if, it got out, the community hopefully would get the information that they could go to this provider, but they're, technically operating, in operation to their opposition to, what their employment obligations are. So it's not actually a workaround. Cool. Yeah, so I was starting to get into some of the advocacy that we've done out. ACLU North Cal has engaged in coalition around what to do, with these hospitals as they continue to take over more and more of the healthcare marketplace. And it's definitely, it's more prominent here on the West Coast where we are, and in the Midwest than I believe it to be in the South. And so for a few examples, back in 2018, and I'll just back it up to say we've done a lot of work around hospital mergers. So back in 2018, Dignity Health and another hospital, Catholic Healthcare initiatives, they proposed a merger in our state that would have made like one of the biggest hospital mergers in the whole country. It was huge. It was massive. They were calling it like a mega merger. And so in California, mergers between nonprofit hospitals, which is really wild that, we consider these nonprofit hospitals, they're businesses, but nonprofit hospitals have to go through a process of being approved by the Attorney General here. And in that process, they have to go through, there have to be public hearings where impacted community members can weigh in about the impact of, the care that they might receive these hospitals merge, and advocates have an opportunity to submit public comments about what services they want to make sure are maintained if these entities merge and become one entity. And so with, the prospect of these two hospitals merging, giving them more power, and then to pick off more non-religious hospitals, because that's the thing, it's like we say there's anti-monopoly laws, but this is like, it's healthcare monopoly. They get to take over, become bigger and bigger and more powerful and take over non-religious hospitals. We saw a big danger to that, to reproductive healthcare and access in California. And so in coalition, we weighed in with the Attorney General to try to make sure, it's big business. We knew we probably weren't going to be able to stop this, but we want to make sure we communicated to the Attorney General what we thought needed to be in place if these entities were going to merge to make this mega hospital system. And so some of the things that, we really advocated for in coalition, either at the public hearings and in our public comments, were ensuring that community members could access, all the healthcare services that they need, including reproductive healthcare, LGBT inclusive care, but also making sure that they actually did maintain services for low income and underserved communities, because that's often what they say is their bedrock and their, what their bread and butter is. But, when, sometimes when these hospitals come together, it actually makes things more inaccessible. And so we also want to make sure that they maintain a certain level of care for Medicaid and Medicare patients in their services as well. And so that hospital merger wound up going through. Like I said, it was like unlikely that we were going to stop it, but the Attorney General did put some conditions upon the approval of that enormous hospital merger. So in approving that merger, there was a requirement that they had to maintain existing reproductive healthcare services for 5 years, within like an additional 5 years for oversight, which is like, such a short amount of time, in considering, what that means for access to care from here on out. But, it was something. And also, there were some conditions around maintaining services for low-income patients and patients on public insurance. But then, as another example, I think because of, the stakes of this enormous merger that had taken place just like a year and a half before, and, through continued advocacy, there was another merger that came up last year in 2019 between a Catholic hospital system and the Adventist health system, which I mentioned earlier, that was actually denied by the Attorney General, which is what I think was the first time that had happened. And Amanda, correct me if I'm wrong, but I believe it was the first time that the Attorney General had said, no, actually, the concerns raised by the advocates, the same concerns that we raise generally with all of these hospital mergers around restrictions and care for low-income folks, decided like they would not approve that hospital merger. And so we saw it as a victory, in some of the advocacy in the space. And also, so what I was also talking about earlier is that a lot of these hospitals target places that are underserved, and hospitals that are economically insecure and unable to meet the needs of their community. So looking to, merge with a larger system. In some places where there's only one hospital for like many, many miles. And so, and 2 rural Northern California communities, both in Mendocino and Healdsburg, we've been working with, local community members to, try to thwart some of the restrictions from proposed mergers with Adventist healthcare primarily. And so with these 2 hospitals, I will say that it was, the advocacy looked a bit different because these were communities that were faced with, having a religiously affiliated hospital come in or having absolutely no care at all, maybe upwards to like 70 miles away, and having to drive like really, really far away to get any health care. And so it was important for these communities to, they said they wanted a hospital, but they were kind of put between a rock and a hard place around like what that would look like. And so what we've done in these instances is tried to advocate that at least, if these hospital systems are coming, that they maintain these services. And that has been, I would say, more of an uphill battle. And then actually, Amanda, I was going to actually kick it back to you. If you want to talk about the UC campaign, because Amanda's been doing an awesome job, like as our lead organizer on this massive campaign we've been working on for a few years. And if not, I will talk about it. But wanted to give you the opportunity.
Yeah, sure. Thank you. Yeah, it's a long timeline, but to give the shortest synopsis as I can. UC, which is one of the largest healthcare systems in California, was planning to expand their partnership with Dignity Health, which is the same hospital that denied Tamesha Means a miscarriage and has also denied a lot of other, and many other cases, comprehensive reproductive and LGBTQ inclusive healthcare. They were trying to expand this partnership in March 2019 is when the campaign really started kicking off, in coalition with other partner organizations and with students and faculty on UC campuses. We really all came together to fight back against this. And in May of that year, UC announced that they would not move forward with this partnership anymore, which was a huge win. But now we're dealing with an issue where UC has actually been developing smaller contracts with many different religiously affiliated hospitals. For example, they'll have residents in certain departments be partnered to be residents at Catholic hospitals, which is then a problem because these residents at UC are learning learning healthcare at a facility that doesn't provide comprehensive care. So things like partnerships like that have been going on this whole time. And UC was going to vote in May of 2020 on whether they should continue having these contracts. But then because of COVID, things have been put on pause and they haven't voted on this issue yet. So it's an issue that we're still continuously tracking and working with our partners, both on the campuses and just our other organizations in California to try to make sure that this doesn't, that these contracts no longer happen. So if anyone has, have heard of similar stories in your cities and states that you're in, would love to hear more about that. Or if you're in California and want to get involved, we'll share our contact information at the end about that campaign. Arnita or Lori, do you have anything to add to that?
Yeah, I was not trying to turn on video. I was trying to turn on audio. I just know that I try to keep up what's going on in my former community area in Indiana. And I know Franciscan Alliance has been trying to take over the Methodist hospitals in Gary, in the area of Gary, which is actually in Maryville. But there's been a big pushback around, and I know that they had beat back the merger, but I know they've been trying to still progress with that merger, because that would make it that only hospital in that area would be then controlled by the Catholic, the Franciscan Alliance, and Franciscan Alliance already controls the majority of hospitals in that area. They control Michigan City's hospital. I mean, they're the biggest religious provider they're a huge provider in the Midwest, huge. So it'd be very problematic. And then there's also the issue of they're not unionized, and they're also Maryville has a huge history of racism. I mean, it was literally developed to be a white community in opposition of Gary, so that white people could leave Gary. So yeah, just multiple issues with that merger. So I'm always keeping an eye on it, on what's developing with that, because I don't feel good about it. You're talking about basically forcing that whole community, which Gary is majority Black, right? You're talking about forcing a whole community of Black folks, and specifically talking about Black people who can get pregnant being forced to have to go to that hospital where they can no longer get sterilizations if they want to. They can no longer get access to infertility treatments. They can no longer get access to certain contraception. They can, there's just a domino effect of that. And you're already talking about an area that's been highly impacted by HIV/AIDS. And I just think about the fallout for the LGBTQ plus community in that area. It's just, I just think of all the activists who have worked so hard to get so far in health work, in the queer community there. That's literally the place that I was first trained to be a peer educator. And I just think of how much work folks have put in on the ground there, and for it to be, kind of impacted by just a bunch of bishops who have never done any of that work, because they want to buy a hospital, is just disgusting to me. That's all.
Thank you, Lori, for sharing that. Yeah, I think that's just evidence that this isn't just unique to California or any one area. Arnita, are you ready to move to the next slide?
Yes, thank you. Yes. Yeah, and so, to support the advocacy space in this area, for the past few years, we have been involved in a story collection campaign called All Care Everywhere, sharing the stories of people that have been impacted by these religious refusals, stories like Lori's and other folks. We would use those in our advocacy. We would take them, ask folks to share them at these public hearings with the Attorney General's office, And we were thinking about ways to also elevate it through our State Department of Public Health. In, to, further illustrate some of the harms and, to personalize some of the harms that are happening. And so on the website, we did this project with the National Health and Education Law Project in help. And, we had a place for people to share their stories, but there also was a portal where you can, you plug in your zip code and it would identify if there were Catholic hospitals near you, like 25 miles, I think, around your geographic area. And so you can see if, there is a Catholic hospital by you, and maybe it links to their website and shows you. I mean, like I said before, it's pretty opaque what services that they disclose that they do or do not provide, but we try to, give some information. And so that's a project we have been working on, and now kind of shifting away. Some of our other partners in this space are going to be actually taking more of a lead in that campaign. And in the past, we currently have cases we've been litigating in this space. We have 2 cases involving transgender men who were denied gender affirming care, specifically hysterectomies, for the purpose of gender affirming care, when hysterectomies can, if not provided for this purpose of sterilization, which is getting back to these workarounds that I've been talking about, actually can be provided in Catholic hospitals. If they decide that it's for another medical reason that they are not discriminating against, they actually can provide it. And so we've been involved in litigation on behalf of 2 trans men, and also a woman who was denied a tubal ligation. Based on getting back to conversations from earlier today and the broader conference and in this presentation, we know what the makeups of the court are. And so, that definitely, is putting a damper on our litigation, I would say, that, it's uncertain, what the outcome will be, but we are not banking on, having success at this stage of litigation. And so, as a result, we've been shifting, our campaign also to root this work in a broader advocacy frame around health equity and justice, because that's what it is. Religious refusals are just one more compounding factor that people of color, LGBTQ people, anybody on the margins, is a compounded health barrier that anybody is facing to getting care. If there's no other hospital where you live, for 30 miles, you have Medicaid, you don't have options. And so we just want people to know about, these restrictions. We want them to be able to exercise and have bodily autonomy to the extent that they can, but also understand that, these restrictions and these barriers have to be understood in the context of everything else everybody is navigating just to get the care that they need. Basic health care, reproductive health care and gender affirming care being basic health care, but knowing that there are so many other barriers. And so we're thinking about, especially in light of the political climate that we're in with the courts, the Trump administration has last generations of damage that we are going to be navigating and how to unpin. So we're going to be dealing with that for a while. So what does that mean going forward for our advocacy, when we know even in states like California, where we have pretty strong laws, we're not seeing some of the religious restrictions to reproductive health care, that other states may face in red states. But, we have this, these Catholic hospitals are, most of the market share now here. And so we just need to be thinking about an overall health justice frame.
Amanda, you're muted.
Oh, sorry. I keep doing that. I was saying, I think before moving to the next section, Monife had another question in the chat. said, for mothers and especially young mothers, are there education or pre-birth classes being provided in these areas that are teaching more holistic methods which help people understand their rights? Do any of you have thoughts?
I think it depends on the area and what's going on with the local organizing in that area. I can just say from the doula community that that's going on all over the place, like just holistically, regardless of Catholic hospitals or not. Like that's just a movement going on among Black birth workers, and setting up childbirth classes and stuff that are outside of hospitals, that are community based, that are FUBU style, for us, by us, you know, like they for us and they are ours, and you know, it's not a bunch of bougie white women, you know, who all have like husbands and partners there, and you know what I'm saying, like you wouldn't be uncomfortable because your friend girl is your partner, or you know, or you because you queer and you got a partner, or because you're, I mean, like seriously, or because you're poly and you have a family, like whatever your situation is cool, you know. So I think that there's a lot more affirming and holistic and even herb-based stuff that's coming out. Like there's like a really great new doula training from this company, this group called Herbal, that's really like dope and like very earth-based and very, you know, like home birth setting, but also like could be used in clinical settings. There's a lot more like birth justice centered doula work being done, specifically in our community, which, as somebody who's been a doula for almost 10 years, let me just say that in the South, especially, when I first became a doula almost 10 years ago in Mississippi, there were only, and I cannot stress this enough, Mississippi is almost 40% Black. When I became a doula, there was only, I could count how many doulas there were on my hands. There was only like 5 of us in the whole state. Not in Jackson, Mississippi, the capital, not in Tupelo, not in the Delta, in the whole damn state. There was only like 5 of us. I could like, when somebody was like, who's the Black doula? It's like, oh, there's Tony, but still like we're named other. I can't do that anymore. I couldn't tell you who all the Black doulas are if you begged me. I couldn't tell you who all of us are. There's so many of us now. And I'm so grateful for that. And that's happening everywhere. I see that happening all over the place. And I'm very excited about that. And there's so much communication happening. So I just think that like that's where that's going to be coming from, is like the doula and birth worker community, but especially from the Black full spectrum, let me be clear, full spectrum doula community, because folks who are only birth centric aren't doing that work, not necessarily, just being honest. They just worried about babies only, and they're not really worried about like a holistic full life experience for folks necessarily. They're just like, yay, babies. Okay. I mean, like you sound like people standing outside of clinics. Congrats. But yeah, I don't really hear that so much in our community as far as birth workers. You know, Black, Indigenous, people of color, that's not really usually our focus. So I'm happy about that. Yeah. And I think it's a lot. I mean, we're really working on harm mitigation is what we're talking about. Yep. I hope that answered your question.
Thank you, Lori. And feel free to write other questions in the chat and we can continue to answer those. But I think we're going to move into the activity portion of this. We'd love for folks to do just like 3 minutes of a self-reflection. And then if we have time after that, we'd love to put everyone in breakout rooms. So it's a little bit of more intimate setting to talk about the self-reflection. So if you want just to take 3 minutes to either think about this yourself, or you can write in the chat if you want to share with folks. Did you know that this was a problem? And do you know if there are Catholic hospitals in your own community So you could look online or look up the nearest hospitals near you. And then from their website, can you tell what types of care they provide? And this is a long list of the types of care that have been traditionally denied at Catholic hospitals. So if you're able to take just 3 minutes now, and then we'll bring everyone back and would love to hear reflections once you do the research.
Y'all, this website straight out says family planning.
What?
The website, like when you go to like women's health and it, like labor and delivery, blah, blah, blah. And then it doesn't say family planning, it says natural family planning. So I'm going to say no to contraception. What?
What are you talking about? That's what I mean, it's
like,
so pain.
Wowzers.
So I think we can just take one more minute. Yeah, and thanks for sharing that, Lori. It's pretty wild doing this research, just looking at the hospitals here. Even us in the Bay Area, you know, where people really think it's progressive.
But like,
So I think we can now just chat amongst our group. What did folks find from this? Anybody want to share in the chat, or you can feel free to unmute yourself and share any information you found about Catholic hospitals in your own community? Well, I can kick us off as an example, and please, oh, actually, Brianna, did you just unmute yourself? Would you like to share?
I'm sorry, what was the question?
Oh, sorry. I just thought that you unmuted yourself. I was just asking,
no.
did you have a chance to look up Catholic hospitals in your own community and find anything that you want to share with the group?
I'm still looking right now.
Okay, no worries. Yeah, I can share just when I've looked up, we have a couple of Dignity Health hospitals near us and in San Francisco. And it's really hard to tell from their website that they are Catholic and also what types of care that they provide. Dignity always likes to tout that they're pro queer, LGBT rights and health, and will say that on their website in different places. And it's really confusing because, as we know, they don't provide the full spectrum of care, especially for trans folks. So that is one thing that I've found just looking at their website.
Hey, Amanda, I can jump in
Sure.
I'm also taking a look at one of the hospitals in San Francisco. That is a Dignity Health hospital, and it's really deceiving because they have a whole section on comprehensive gynecological care. And if I were to read that, it would, seem like they would actually mean comprehensive reproductive and sexual health care, but they're kind of emphasizing that they specialize in treating conditions with modern and advanced surgical procedures, which I don't know, it's just like a very deceiving section saying that it's comprehensive.
Yeah, thank you, Sonia. Definitely something I've noticed with Dignity as well, in addition to other Catholic hospitals, that they say that they provide the whole spectrum of care, even though we know that that's not what's happening. Anyone else want to share in the chat? Oh,
I'm sorry. I can say that on the website for St. Dominic's in Jackson, which is the only Catholic hospital in central Mississippi, everything is gendered. So very well it's not made to be inclusive. If you look at everything, like, first of all, it's women's health. It's not like, it's everything is very like, it's a father-wise class. It's a women's childbirth class. But the thing on natural family planning was what got me is like, usually you'll have like a family planning section under like women's health. And then underneath it, it has NFP is a mutual method of family planning and enhances communication and respect between couples. In addition to it being an inexpensive method, NFP works without the use of drugs or devices that may have harmful side effects. So they're basically shading hormonal contraception as if it's like harmful, but they're like a medical provider. That's what killed me. I mean, it's like some low-key propaganda, but it's also, it's not explicitly bad medical advice, but it is, right?
Yeah, thank you, Lori. That's just terrible. And, it's terrible how common that is. Even being able to just find that on a website. And then I think Gail shared in the chat that Gail looked up Brooklyn Hospital Center, but you can't tell it's Catholic affiliated by the website. And it has a women's health center, but it doesn't include any of the listed services. That's interesting. It's hard to tell, as Arnita shared about in the Bearing Faith journal that was shared earlier. It's really difficult to tell a lot of these times if a hospital is Catholic, which is then deceiving when low-income patients of color are generally the ones using these hospitals and then don't even know that they'll be denied those services when they go to the hospital. So thank you, Gail. Sarah just shared, it's interesting to hear about people who are in urban areas who have multiple hospitals. Sarah's county only has one hospital, and thank goodness it's not religiously affiliated. And that's the issue, that these hospitals are buying up sometimes the only hospital in the county, making it religiously affiliated, so then people don't have other options for other places to go. Thank you, Brianna. Select Specialty Hospital came up. Oh, interesting, but no women's health center. Thank you. Oh, interesting. Lori, I don't know if you see what Paulina wrote in the chat about Indiana, but Franciscan
I did. And I smell some bullshit like from the state. That sounds like garbage. Yeah, they are right. Franciscan health is everywhere. Like, you cannot really escape them in the state of Indiana. Like, they're everywhere. And the thing about northwestern Indiana is they really have a hold on that whole area. Like, I did not get away from their care until I moved to Fort Wayne. And I feel like eventually they'll take over that end of the state too. Like, that's their goal, is like, I mean, they plan on having the whole state. And it's scary because now, I mean, look, now they're getting awarded money to combat infant mortality. I'd like to know how they dropped infant mortality from one of the highest rates in the country to one of the lowest in history in 1 year with only $600,000. I mean, if that's true, they should be like the model for the nation. Versus, I don't know, the California program that really has had really good results, but it wasn't that kind of results. I mean, no one's had a program that had that kind of results. That's just absurd. They must have just counted white babies.
Oh, go ahead.
Oh, I said they must have just counted white babies. Because that's like the only way that could have happened. I'm just saying.
Very skeptical. would love to see that data too, Paulina.
I've got questions. I got a lot of questions.
Yeah, lots of questions. Thank you, Paulina, for writing that. Yeah, please continue. If you keep doing research, feel free to keep writing that on the chat. Since we have just a couple minutes left, we originally were going to put y'all into breakout rooms, but since it's a small group, we could just share. You could unmute yourself or put in the chat. If you were to go to these types of hospitals that deny care, what are the types of questions that you would want to ask to find out about the types of care that are offered? And are there questions that you can think of to ask your provider? And also, what types of care are you most concerned about not receiving if you were to go to one of these hospitals? So would love to hear thoughts on any of these questions or on the previous self-reflection questions in the chat, or feel free to unmute yourself for these last few minutes.
So I can just give a personal example. My daughter's provider was linked to our local Catholic hospital while she was pregnant before she had her midwife. And at one point she was thinking she might be having a miscarriage and she was going to go to the ER. And I didn't know she was going to go to the Catholic hospital, and she did. And I lost my mind. I was like, you know better. And she was like, I'm fine though. And I was just like, I know you know better, right? So like, it's not just my fears about me. I don't have a uterus anymore, right? But I have fears for my daughters, right? So I feel like it's not just about what are our fears, but like, what are we teaching our next generation to ask? And I also worry about, like, we haven't even touched on end of life care and the way they step all over people in end of life care. So I just think that there's like so many issues around like not receiving care, but not even respecting whose people's chosen family is. Like, we had an issue at that same hospital when my mom was sick, and my mom is white, or was white. My daughter was up there visiting her, and they actually stopped her and was like, how do you know Laura? And she was like, I'm her granddaughter. And they were like, really? Like, they were actually going to grill her because they didn't believe that a Black girl was this white woman's granddaughter, as if she was in the ICU to rob her. Like, how do you think she got in there? I mean, seriously? My mom was in a coma. I mean, it was just so bizarre. So I just think it's like, there's all these levels of like racism, but also like just the way that Catholic hospitals operate around not respecting people's families and like wishes, and not even thinking that chosen family is a thing. Because if you thought chosen family was a thing, you wouldn't have stopped somebody who wasn't the same color as someone, because you would have thought that maybe they weren't their biological family, and that's okay.
Yeah, thank you, Laurie. That's such an awesome point, that this is not just impacting you, but yourself, but also your community and your loved ones. If any of them go to the hospital or go try to receive health care. Yeah, I know we're at 1 minute, so please feel free to unmute yourself or chat if you have other questions or comments. But we just really appreciate you coming to this session, and here's some contact information. If you'd like to reach out, please feel free to do so. This has been a really great conversation, and also put again in the chat the link to the website, All Care Everywhere, that we talked about, if you want to learn more about this issue.
Hi, it's Abriana. I just had one quick thing. I was gonna say that I fear for young women who don't realize that they're pregnant early enough to make if they wanted to make a decision based off where they live at, they wanted to get an abortion, and then their only option is this hospital that won't allow them to get an abortion. So that would be my fear.
That's real. And I feel like that's why community education, like I believe a lot in peer education. Like, I feel like that's why, each one teach one, us talking to each other is so important. So that if you're in that position, or even if you're in the position where you didn't even really realize you were pregnant and you get to the ER because you just thought you were sick, and now you realize you're having a miscarriage and you're at a Catholic hospital, you know that you can get the hell up and go to another hospital if there's another one available. You don't have to fucking stay there. Or you can, if you're not in a position where you're dying, you can get up and go to a regular provider. Like, you don't have to stay there. That you don't have to let them manage your miscarriage. I didn't know that. I didn't know that I could have asked for an ambulance and been transferred to the hospital in the town next door. Or I could have called a friend. I could have left AMA and went to the next town after they had given me enough fluids and stuff where I was stable. Like, nobody told me that. Nobody told me after the second time I was there, I could have just went to LaPorte and I would have been, I'd have been fine. But nobody, it's not like the Catholic hospital was like, hey, you don't have to deal with our nonsense.
Yeah, thank you, Laurie. Arnita, were you gonna share something?
No, I was just gonna say, I think the point that Laurie's been driving home around our community health and us taking care of ourselves is so crucial, especially, the political climate is going to be here for a while. We're going to be dealing with this for a while, even as we move towards liberation. It's a long haul. So thinking about how we can share this information through our own networks, especially for young people, especially for folks that, we know wouldn't have other options to seek. Like, how can we support them in making their decisions about their bodies to the extent that we can control it.
Thank you. And I think that that's an awesome point to end on, just that, this information, please share it with folks in your community. And that's the best way that we can all take care of ourselves and our loved ones. And we just really appreciate all of you taking the time today to join this. I hope you keep in touch and stay healthy and safe out there, and enjoy the rest of the conference.
Thank you, everybody.
Thank you all.